Dr. Joseph's latest YouTube video examines an article that was recently published in the JAMA Psychiatry journal titled Dopamine-Blocking Antipsychotics, Time for a New Conversation with Patients. In reference to the doctor who wrote the article, Dr. Josef states that he essentially says it's time to come clean about the side effects of antipsychotics. I would note that these effects should not be called side effects, but rather the main effects, since they are the result of what the drugs are designed to do. I also do not personally refer to these drugs as medications or medicines, as I do not think that they meet the criteria to be classified as such. They are simply drugs that sedate, suppress, and degrade those who are subject to them. I think it is important to establish this and define terms appropriately as a basis for a conversation about these compounds and their effects. The article states that this may be a time for prescribers to be more transparent about the problems with dopamine blockers. Why now? Why have they not been transparent about these problems for the past 50 years? Dr. Josef raises this question of timing in the video. The article also states that the more subtle potential effects of these medications on subjective experience, motivation, and quality of life seldom come up in conversations. First of all, there is nothing subtle about these effects. As someone who has been on antipsychotics, I assure you that the effects are quite significant. Also, I would argue they are not potential effects, but rather guaranteed to occur, barring a miracle, when one has an antipsychotic drug in their system, especially at the dosages that are considered to be therapeutic. I would also argue that these particular effects do come up in conversations, but psychiatrists often refuse to acknowledge them as resulting from the drugs and associate them instead as part of the illness. Antipsychotics can make people depressed and withdrawn, Dr. Josef says in the video regarding what Dr. Marder, one of the authors of the article, has written. Dr. Marder writes, patients with higher dopamine occupancy from the drug experienced greater depression and more severe negative symptoms. Again, as someone who has experienced firsthand the effects of antipsychotics, I can attest to this. Regarding dopamine blockade and motivation, the researchers state, dopamine is crucial for regulating the voluntary pursuit of goals, particularly when this involves exerting effort. Going from my dopamine flowing freely to being blocked, I 100% agree with this statement. Importantly, dopamine blockers reduce motivation for various adaptive activities, including the opportunity to engage in rewarding social interaction. I would argue that the rewarding social interaction also loses its rewarding characteristic because the patient is no longer able to experience any rewarding feeling from engaging in such behavior. Dr. Marder also writes that it is plausible that chronic dopamine blockade may, I would say does, lead to a worsening of the apathy and lack of goal-directed behavior that is common in schizophrenia. Is the reason that apathy and lack of goal-directed behavior are common in people diagnosed with schizophrenia because these people are on antipsychotics? I would say yes. For individual patients, clinicians should consider the possibility that dopamine-blocking medications may lead to lives that are diminished by a decreased experience of rewards. Maybe the reason that nobody seems to recover from schizophrenia and that it is considered a lifelong illness is because they are all on antipsychotics, which completely blunt their motivation and reward systems, preventing them from feeling motivated to change/get better. If you are diagnosed with schizophrenia, subjected to an antipsychotic drug, and placed on disability, your internal reward systems, and thus your incentive to put in the work to resolve your symptoms, get better, seek meaningful employment, and come off of disability payments is just not present. In regards to the section of the paper on lessons from dosage reduction and antipsychotic withdrawal studies, chronic dopamine blockade, particularly at higher doses, may worsen functioning and quality of life. I would say that not just chronic dopamine blockade, but short-term dopamine blockade too, does worsen functioning and quality of life. I say this from my experience. When patients seem disinterested in pleasurable activities, or less interested in social, educational, or vocational activities, which will happen to someone if they are subject to an antipsychotic, clinicians should not prematurely conclude that this is only a consequence of their illness. They should consider if chronic dopamine blockade is contributing to these very consequential limitations. I like how the researchers at least seem to acknowledge that these effects are not a result of the illness, but rather results of the antipsychotic drug treatment. Chronic dopamine blockade is not merely contributing to, but rather is causing these limitations. Also, he is correct in using the word when and not if, because patients will experience these adverse effects due to antipsychotics. What do you expect to happen when you block someone's dopamine, given what we know about how dopamine functions and what it is responsible for?